I need to use a towel, or I'm going to have a little thing of water going straight down your back into the little crack of your behind, which is called a, do you know? Your crack of your behind?
They call it gluteal.
It's not your gluteal cleft.
Yes, we learned that yesterday.
Okay.
My documentation.
I wasn't going to say that out loud.
What'd you put in?
When I was
womb observation.
So, the crack between your two cheeks is the gluteal cleft, and the bottoms of both of them are gluteal folds. Excellent. So if you have some junk in your trunk, you have two gluteal folds and one gluteal cleft. It is not a butt crack anymore. Just say no to crack.
Say no to crack.
Okay,
This would be
so
interesting for our viewers.
That one there needs to go on YouTube.
I'm going to get sued at some point, I'm sure. So I do not want water running down their back into their gluteal cleft. And I've seen people do it on practice. I've seen them do it in the clinic, and it is cold when that freezing cold water runs down your back into your. So it is very important for you to have towels and stuff to prevent dripping. Well, I see people in practical, they're doing an ice massage in a knee, and they're just doing this number, and that water's dripping down their leg into their sock. So you need to get yourself a towel and position this person so that whatever's getting cold is just what you want cold, and that you're mopping up the water. So Jocelyn was kind of teasing, but she was absolutely right. That's one of the big differences. What's another difference?
Your hand could get cold.
It's direct, so my hand can get cold. So I usually, personally, I just grab the ice cube because I've got no sensation in my hands, I guess. But they do make these. You can put a little light tongue depressor in there to make a little stick, or some people will try to, pull it out and turn it over and do this, or some people will make these in paper and styrofoam cups and start peeling it. So any
They
way
have
you want
actual
to do
cryo
it.
cups too
They
that
make
have little
cryo
nodules.
cups. Some people will go get a towel. A towel's not a bad thing because then it's starting to soak up some of the other thing and your hand's not getting wet. So whatever works for you. I'm not giving you style points but I am taking off points for dripping cold water down somebody's body parts. Okay? Here, I'll ice massage myself, so nobody has to volunteer just yet,
You
but
can,
eventually you're
I
going
don't
to
care.
have to. So I like towels around. I like a towel. So I've got, this is my, what is this on me anatomically? What's probably wrong with me? Yeah, well, what's over here?
Oh, epicondyle.
Okay, my biceps comes right there. So this is those muscles that does this.
Oh,
Okay,
extensor.
and so what do I have wrong with me? Tennis elbow. I have tennis elbow, which is my lateral epicondyle. Lateral epicondylitis is tennis elbow. So I have tennis elbow. And I don't want to just set it on there. I want to keep moving. And just small little, okay?
Are you applying pressure or just?
Nope, just the weight of the ice cube. Okay? It's important for me to describe to the patient, I don't think I said this about the ice, but what are the stages I go through? Numbness, tingling. What else?
Redness.
Okay.
And then after that, yeah.
Numbness is left, right? Or not
It's
being
last,
completely
isn't
numb?
it? Yeah.
That's the last
Intense
one.
cold, burning, aching, analgesia.
Okay, so burning. So you need to tell your patient, when we do this, especially with an ice massage, you may feel different sensations. You may feel burning. You may feel, what else did you just tell me?
Burning, aching.
Aching.
Analgesia.
Okay, analgesia would be loss of pain relief. So it's going to go numb. Eventually it's going to go numb. So if people know that it could hurt, it could ache, it could burn, they're more likely to be able to take it. Okay. Once it's once it's numb, I can usually stop. So how long do I ice massage usually?
Isn't it like under 12 minutes, I think?
Depends.
There you go.
Depends on what. Smart Alex.
How long
At least
it
I
takes
can
them
tell
to
you
go
what it
through
depends on
Yeah.
usually.
It says 5 to 10 minutes and then reassess
Okay, so for ice massage or for ice pack?
for ice massage
Okay, so I would,
until the patient experiences analgesia.
right, so I would never go more than 10 minutes. It's usually 5. They're usually about done.
So you're saying.
5 to 7.
Are you feeling anything? I mean, how do you?
Numb. Tell me
are
when
you
you're numb.
Okay.
Are you numb?
I'm not numb yet because I kept stopping. So what if I had it on the other side, right there? What would it be now?
Medial epicondylitis.
Medial epicondylitis, which is called what? What kind of elbow is that?
Tennis?
No, this
No.
one was this was
That's
tennis elbow.
tennis elbow.
Golfer's
Golfer.
elbow.
The right elbow is when it pops out.
Yeah.
of the joint.